Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the CAUCUS Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by Johnson & Johnson, MagnaCare, United Airlines, the Northward Center, NJIT, New Jersey Institute of Technology, PSE&G, committed to improving New Jersey's economy and strengthening its communities, and by the Russell Berry Foundation. Promotional support provided by POLITICKERNJ and by Commerce Magazine.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No. People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Hi, Steve Adubato. We're here in Philadelphia, the city of brotherly love. Hundreds of people have come together for the Healthcare Collaborations Summit put together by Virtua and the folks at CHOP, the Children's Hospital of Philadelphia. There are healthcare executives, public policy makers, all sorts of folks who have come together to talk about collaboration, talk about partnership, talk about bringing down healthcare costs, talk about transforming the way healthcare is delivered. There are panel discussions, there's a fireside chat that's about to come up. What we did was we talked to all sorts of leaders who have come together here in Philadelphia for this very important summit. Let's take a look at what some of those leaders had to say about the new world of healthcare. We're at the Healthcare Collaborations Summit here in Philadelphia, which would not have been possible without Rich Miller, who is the President and Chief Executive Officer of Virtua. The folks at Virtua and CHOP have brought everyone together here. Rich, a couple of years ago, we were down here with our crew. We talked to some great folks. The theme here is about collaboration. Talk about that.
Well, actually, we've built a great collaboration with Children's Hospital, Steve, right here in Philadelphia, and actually caring for, and you've been with us through that, caring for people in New Jersey. All the kids that come to our ER in New Jersey are treated by CHOP doctors, our NICU CHOP doctors. So it's a collaboration where the sickest kids come across the river for their care, but if kids can be cared for in New Jersey, they will be. And in line with that, our Penn situation, our Penn relationship. Which is new. It's weeks old. It's hot off the press. In cancer and neuroscience does the same thing. Very similar relationships where Penn, if we need to transfer somebody to the city for a high level of care, we can do that. But the goal is to care for patients in the community.
Now, there's a lot of activity. We're in between panels. There are a whole range of terrific panel discussions here at the Marriott in downtown Philadelphia, the city of brotherly love. But the next panel, I believe, is a CEO panel, if I'm not mistaken, Rich, about collaboration. Talk about that.
Yeah, we have a great CEO panel. All the major hospitals in Philadelphia, Jefferson, Penn, CHOP are represented. Christiana in Delaware will be on the panel. We also have CVS being represented on the panel. So the goal is to talk a lot more about collaboration and how maybe 10 years ago, these systems wouldn't even be talking to each other. And now it's important from a cost reduction standpoint, a service perspective, and access perspective to have these large systems talking to each other and collaborating.
Explain that. You know, the cost issue, is that ultimately driving all these collaborations, Rich?
Yeah, I think it's a major part of it because we understand in healthcare that we got to lower our cost. Because the consumer can't afford us anymore, Steve. I mean, we really, business and consumer. So we know we have to get our costs down. And premium dollar is starting to come down to the consumer. The other issue is the consumer's paying for this now. They're shopping for their insurance products on the exchanges. So they're looking for low premium product. And frankly, if we don't lower our cost, we're going to lose dollar for dollar on every patient that comes into our locations.
But there's a quality piece of this as well. Talk about it.
Yeah, quality is crucial. I mean, the key to everything is quality, safety, cost, and access. Those are the key measurements that you really have to look for. I mean, you could have, if you have low cost, you're not going to have low cost with poor quality and safety. Good quality and safety drive the cost paradigm. So costs will drop as safety and quality improve, and then we're balancing we're balancing the services we provide. We're not duplicating. We're providing services in locations that benefit the consumer but will lower the cost.
Rich talks about locations. You take a look. You got CVS Health. I mean, I have to tell you, CVS is more a part of our family's life when it comes to healthcare than I ever would have thought even 5 or 10 years ago. Again, we're not focusing just on CVS because they're a big part of this, but the truth is, that wouldn't have happened 10 or 15 years ago.
No, I mean, actually, we have Virtua has the partnership with CVS in southern New Jersey, and we oversee their minute clinics. So our primary care physicians actually monitor their minute clinics in southern New Jersey.
Describe what goes on at those mini clinics.
Well, you have a nurse practitioner model in certain CVS stores in South Jersey, and they treat minor illnesses for the patients. So if patients want to come in with a cold or a flu and they need a script or an antibiotic for it, they can come to CVS and get it. If they don't get it there, Steve, then they're sent over to Virtua's urgent care, where they can see a physician in urgent care if it's a more serious issue. And eventually the goal then is that if that is not the appropriate venue of care, they come to the emergency room.
Another collaboration?
Another collaboration. It really is a collaboration. And part of that collaboration is interesting because now CVS does bedside delivery of medicine before a patient gets discharged. So for example, if one of our patients in any of our hospitals in southern New Jersey is being discharged and they need a medicine to go home with, bedside delivery occurs so the patient doesn't have to stop on their way home. CVS provides that to us.
It's actually changing the way patients are treated in all this as well, because normally I would think, like, here's the prescription, you got to go to the pharmacy, and then you don't have it for God knows how many hours, right?
Yeah, how many hours? And then the key is, Steve, does the patient even pick up the prescription at some point?
Compliance.
Compliance, because if the patient's non-compliant, they're back in the hospital maybe in 2 days or 3 days being non-compliant. So we want to make sure that that prescription drug gets in their hands and they start taking it. Beyond that, we send a care coordinator or a nurse to go to the home and make sure the patient is compliant, so we don't see them back in 24 or 48 hours.
Last question, and they're about to get ready. You sense everyone's ready for this next panel. Most important takeaway for people who have come here to Philadelphia for this Collaboration Summit, what would you want people to walk away with and ultimately do?
Well, we're really talking about changing the delivery model in healthcare. We want them to walk away to understand there's a better way to deliver healthcare in partnership with others. We don't have to do it all ourselves. So, we're not going to be a burn center or a quaternary care center. We're going to bring in partners to do that. We did it in hospice care. We did it with CVS. So the goal is to bring the relationships together, people that know how to do it with a lower cost model. That's what we're looking for.
We're here in Philadelphia. The two organizations that have come together for this Collaboration Summit, Virtua, as you can see behind us, together with the Children's Hospital of Philadelphia, and the President and Chief Executive Officer of CHOP, Madeline Bell, joins us. Congratulations on this summit.
Thank you so much. I'm really pleased to be here.
Talk about why this summit's so important.
Well, the summit's about collaborations, and I think we all know that there's a lot changing in healthcare, and together we can achieve more to have healthier communities.
Now, you're part of a CEO panel talking about collaboration. So give people a sense. First of all, make the Virtua CHOP, Children's Hospital of Philadelphia connection clear to folks. I mean, we understand it because we've covered it in the past down in Philadelphia, and we know the connection with Virtua. Explain that to folks.
So we've been working together with Virtua for about 5 years, and we have children's hospital doctors and programs at the Virtua hospitals. So our goal is really to keep children close to home and in the community, in the hospitals that are in their community that they know and trust, and to build their capability to care for children with the CHOP doctors and programs. In the case that the child gets very sick and needs specialty services, inpatient services, they come to the CHOP main campus.
But Madeline, let me ask you this. When it comes to collaborations, people say, well, hospitals compete with each other, and hospitals are often very aggressive in their marketing and branding. And how is it that you're able to come together, and why is it so important to come together, particularly in this healthcare environment, when in fact dollars and having patients, dare I say, come in the door continues to be important?
Well, I think collaboration is a way for us to bring, especially with the Children's Hospital, specialty services to the community so that we can actually keep the cost and the convenience right-sized for families so that they're not...
Give us an example of that.
So I can tell you that many patients come to our hospital just because they need a consult with a subspecialist. It makes no sense to put somebody in an ambulance or fly them from one hospital to the other. So for us to be there and just to be able to provide that consult or those special imaging services, it keeps the child in the community close to where their family lives, to an area that's comfortable to them. But knowing in the back of their mind, if something happens that really requires a high level of service, that there's an integration, which is the collaboration between CHOP and Virtua, and that'll be seamless to them to seek care at our main campus.
You know, it's interesting, for those of us who have small children, the CHOP brand has always been known, you know, it's always, and unfortunately, or fortunately, depending upon how you look at it, for those of us who have friends or family members who have children who have been very sick and have wound up at Children's Hospital of Philadelphia and been taken care of, the care is really extraordinary. Describe the building of the CHOP brand.
Well, the brand...
Over how long a period of time?
Okay, well, our brand started 160 years ago. We were the very first children's hospital in the nation. And
the first?
The very first. Started here in Philadelphia, like a lot of firsts, in this Delaware Valley area. And our brand has really been associated with quality and excellence because we really strive to hire the best and brightest scientists, physician scientists, who are discovering new cures and new treatments, and what's called translational medicine. We're translating those discoveries to the bedside. I remember a time when certain procedures in neonates, premature babies, were really only done at our main campus. Now those are done at the Virtua Neonatal Intensive Care Unit. So most patients can stay there. So that's really our goal, and that's really what our brand stands for, that innovation, that translating that to the bedside. But now a step further, not just translating it to the bedside, but translating that to the community. So community hospitals that are known and trusted in their backyard.
I'm curious about something. Given the pressure to keep costs down, given the fact that a lot of this summit is about healthcare costs, and the fact that a lot of folks have talked to us about the fact that healthcare costs as a percentage of the gross national product is higher than ever before, you got to bring it down. Everything you just described is incredibly expensive, that specialty care. How do you square that incredibly expensive care, what it seems to be expensive, with the need to keep costs down?
Well, I can tell you that care is a lot less expensive at a community hospital than it is at our main campus. So we try to preserve our main campus for the most complicated, the children that have had cancer relapse, the children who need open heart surgery. We don't like to impose that cost structure, frankly, on a community hospital or in one of our specialty care centers that are in the communities of New Jersey. So
is that part of, quote-unquote, population health?
Well, it's a component of it. It's a component of managing care in a more prevention fashion and at the primary care settings, or really teaching families to be healthier. But it's a lot less expensive to deliver that care in one of our specialty care centers or community hospital partners in New Jersey than it is at our main campus. So for us, the collaborations actually give us a venue to provide care that's a lot less costly than our main campus.
So it's so interesting. So the whole idea of collaborations. See, on one hand, you'd think like the CHOP people would want everyone to come to CHOP, and that's not the case.
No, actually, it doesn't make sense because we have, all of the most complex equipment and physicians that are super subspecialists in specific areas, and not every child needs that. We want to bring care, the appropriate level of care, to the appropriate patient in the right location, and that's really what we're about.
Thank you so much.
Very nice to be here. Thank you.
We are in Philadelphia, and we're with Corey Coleman, Executive Deputy Secretary, Pennsylvania Department of Health. This is the city of brotherly love. People are feeling it, right?
Yes, yes. Everybody but the Eagle fans right now, so let's not.
Okay, we're in the football season as we're doing this in the fall of 2015. Those of us in North Jersey and the New York area, we're Giant fans, but we'll leave that alone. This is about collaborations, Corey. What are you doing?
Absolutely, absolutely. So let's talk about collaboration.
Yeah, one of the areas I want to talk about. It's interesting. You and together with the governor, Governor Tom Wolf of Pennsylvania, heroin epidemic, serious problem across this country. But talk about what's going on in the state of Pennsylvania in that regard.
Number one, a significant challenge nationally and also for the Commonwealth of Pennsylvania. Some alarming statistics around the heroin epidemic. 1 in 4 families today in Pennsylvania are impacted by the drug overdose issue, specifically opioid overdose. What we've done to combat this directly, number one, the governor called our Secretary and Physician General together earlier this week to sign a standing order which made a drug called naloxone available to many law enforcement officers, first responders, because again—
What does it do?
So this is a drug that it's a counter to what happens with heroin, and it's the exact opposite. Heroin, you take the drug, the effect is it slows down your heart rate, it slows down everything that flows in your body to the point that it stops beating, the heart stops beating. So the counter drug, naloxone, when it's administered within 30 seconds, will revive you. I mean, it literally is a miracle drug, but it's only if it's given to a patient at an appropriate time within an appropriate setting. So that means if it's not available, many people actually do pass away, which is why it's such an alarming disease here, or an alarming issue for many folks in Pennsylvania. So separate from the standing order, our department is working with many physicians throughout the Commonwealth of Pennsylvania on prescription guidelines, which is really around how are physicians handing out prescriptions to patients. Do I need, I don't know, 60 pills of codeine for a toothache that may only last a week? 60 pills.
And should you be getting that many?
Should I be getting that many? So really working with the physicians to think about, number one, how should we be prescribing these medications, which do lead into the prescription drug overdose issue.
You know, it's so interesting. As we listen to you, you're talking about collaboration between state government, physicians, pharmacists, right? I mean, that is the spirit of this conference, this summit.
Absolutely, absolutely. And the law enforcement officers as well. And as a matter of fact, we actually are working on our prescription guidelines and a ABC MAP program, which will—
What does that mean?
So essentially, this is our prescription drug monitoring program. And it was signed into law last year. And we are working as we speak on working with the stakeholder group you've just outlined to look at where are the hot spots in Pennsylvania. This would allow us to create a system to identify a provider in Section A or Section B that is prescribing at an alarming high rate compared to his counterparts. And that system would allow us to sort of rapidly respond to the provider to say, hey, why are you writing out so many pills of codeine in this particular month? So.
Let me ask you this. A summit like this, the folks at the world-famous CHOP, Children's Hospital of Philadelphia, together with the folks at Virtua, bringing everyone together at the summit. I mean, we've been here before. It's amazing the folks that come together. What is the significance of a summit like this for you and the governor and the folks in Pennsylvania who are so concerned about healthcare? Why is a summit like this so important?
Well, I think collaboration is critical. Best practices around the nation and within the region are important to share.
Also crossing state lines.
Exactly. And just in our region here, having the ability to find out what New Jersey is doing, what Delaware is doing, and to share that information with what we're doing is critical. And I oftentimes think about the book Going from Good to Great.
Yeah, Jim Collins, Good to Great.
And so you can't get from good to great if I'm just in my silo and I'm only worried about Pennsylvania. So how do we work with other states nationally and regionally to make our region the best region in America? So
if you were to describe some of the most pressing healthcare concerns in Pennsylvania, do you think that they would be significantly different from the healthcare concerns in Delaware or New Jersey?
No, plainly no. Generally, most of the top healthcare issues around the nation are very similar. So diabetes, coronary artery issues, asthma, cancer, and
childhood obesity.
Obesity. A lot of this is driven by behavior, though, and this is, I think, what a lot of us are discussing in the summit here, which is how do we engage patients on healthy behaviors? eating well, exercising. These are the real social determinants when those things aren't happening, when you're not eating well, which then leads to what? Obesity and heart condition issues for many of our patients.
We're at the Healthcare Collaborations Summit in Philadelphia, put together by the folks at Virtua and CHOP. We're here with Dr. Stephen Klasko, who is President and Chief Executive Officer of Thomas Jefferson University and Jefferson Health. Doctor, you actually said that healthcare missed the consumer revolution. What exactly does that mean?
Well, we did. I mean, think of everything you can do in the rest of your life you can't do in healthcare. So my kids, the Friday after Thanksgiving, instead of going to the mall, they're in the pajamas watching season 4 of Game of Thrones, doing all their holiday shopping. But if they have a stomach ache, they can't get an appointment with a doctor. They can't go and literally have a seamless experience like you have in travel or anything else. We started at Jefferson virtual rounds.
Virtual rounds.
Yeah, so think about this. If, God forbid, if your mom or dad is in the hospital and you don't live in that city or in the cancer center, hi, Mom, what did the doctor say? I don't know. He came in at 5:30 in the morning. I have no idea what he said. That's in 2015. So we started a model, partnered with a company where we actually send software to their loved ones. They can actually participate in rounds. Now, when you think about it, we're proud of it at Jefferson, but we could have done that 5 or 10 years ago.
Why didn't we?
Well, because I think that you, patients, let us get away with it.
Wait a minute, it's our fault?
Yeah, because in fact, I'm writing a book called I Messed Up Healthcare in America, Put Your Name Here. Because everybody else blames everybody else. The fact is, what you guys put up with in healthcare from a service perspective, from the kind of bills you get, from how long it takes to get an appointment, you wouldn't do in any other area of your life. At Jefferson, we call going from the Blockbuster to the Netflix model.
The Blockbuster to the Netflix.
Think about this.
I love Netflix.
Okay, but so Blockbuster was where you got your entertainment. And they made the mistake of thinking it was about the stores. We're making the same mistake with hospitals. We think it's about our hospitals. It's not about our hospitals. It's how can we get our care out to where people are. So again, at Jefferson, we're not investing in new beds. We're investing in things like telehealth and how can we get Jefferson Care and Caring out to where people are.
So, wait a minute, but you're saying, you make it sound as if we could have demanded this. And most citizens are asking policymakers, asking politicians, I mean, why can't you fix this, fix the healthcare system? And then you're saying, wait a minute, it's about us.
Yeah, because I think what you'll start to see is we start to push that envelope at Jefferson and we say, look, you'll be able to make all your appointments online. You won't have to call an answering machine and wait for 11 options. Then people are going to go to the other doctors and say, why aren't you doing this? When I was in Florida, we guaranteed same-day mammograms. The amount of time, at that time, it was 5 days from the time you got a mammogram to the time you got the result. We guaranteed same-day mammograms. Everybody told us we were nuts. You go down Route 275 in Florida now, all the signs are same-day mammograms guaranteed. So once you start
change the market.
Once you start to disrupt the customer service model. Once ATM started at one bank, you couldn't decide that you weren't going to have that. It just hasn't happened in healthcare. I'm not saying it's been a conspiracy. It's just that we haven't had to do it.
Is it going to continue to move in this direction?
No, I think really the only question is whether or not it's healthcare systems like Jefferson doing it or whether it's entrepreneurs. I was with 130 deans back 5 or 6 years ago when Walgreens said we're going to see patients in our pharmacies. They laughed. What a stupid idea. Who's going to go to a pharmacy to see a nurse when they can see me? You know, I'm a doctor. Well, meanwhile, $15 billion later in the fastest growing segment of healthcare. Why? Because we didn't recognize it's not about seeing nurses in the pharmacy. It's about if your kid's a little sick and you have to wait 2 days to get an appointment, now you can go to the pharmacy and get some ear drops or eye drops and the kid's comfortable sleeping, you're having a glass of wine. That's a very different thing. We could have stopped that by keeping our offices open.
And we didn't because?
We didn't because we didn't really think it would work.
Is that hubris?
It's a little bit of hubris. It's a little bit of a guild mentality among physicians that, you know, I'm a physician and it's different. We're not a consumer. We don't like to call our patients consumers. But the fact is, you get a panel together of 25 to 35-year-olds that will cancel their Uber if it takes more than 5 minutes and ask them if they'll tolerate the care that you get, or at least as far as the customer service. And my guess is they won't.
You've also talked about changing the model of medical education and the need to have our future physicians be more empathetic, compassionate, and be able to communicate in a different fashion. Talk about that.
Look, Steve, it's a little bit like the other issue. We still accept students based on science GPA, MedCats, which is a multiple choice test, and organic chemistry grades.
What's wrong with that?
Well, and now we're amazed that doctors are more empathetic, communicative, and creative. As my kids would say, duh. So when I was applying to medical school, if I knew 19 reasons somebody had a headache and you only knew 15, I was a better doctor than you. Now the 19 are on my iPhone. And half the students who we admit to medical school can't communicate, can't see different colors of yellow. So what's more important? Is it the human component or the fact that you might be able to memorize a couple more things when now there's going to be a robot or a Watson next to you memorizing all the things that you can memorize? What's changed is there's no human brain on the planet that can memorize every genomic sequence. So in a few years, I'm going to have a robot or a Watson next to me. What I add to the equation is my human empathy.
So you're talking about, sorry for interrupting, you're talking more about, as Daniel Goleman refers to, emotional intelligence.
So that's what we did. We started a medical school. We're actually partnering with Princeton University, where the day that the students get in, they actually get into Jefferson. And we encourage them to take the least amount of science courses they have to take. They don't have to take MedCats. We want them to be great people. We're partnering with Atlantic Health in New Jersey, where literally all the clinical matter will happen at Atlantic Health. We're choosing the students based on emotional intelligence. By the way, that's how pilots are now chosen for Southwest Airlines. They used to choose them basically on technical, but now it's based on emotional intelligence and communication skills.
And all this in the end, you believe, means what for consumers of healthcare?
What it means for consumers of healthcare. So I've delivered 2,000 babies in my life. It's not hard delivering an 8-pound baby to a normal patient. Delivering an unscheduled Down syndrome baby, and they say, what does that mean? How you answer that first question means the world to that patient. And the emotionally intelligent doctor will understand that how does that mean does not mean what's wrong with my chromosome. What does that mean means what does that mean to my image of a perfect baby. So literally part of our job is to really be an advisor, to be able to help patients.
A trusted advisor.
To be a trusted advisor, and that's not in organic chemistry grades.
Thank you, Doctor.
Thank you.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Johnson & Johnson, MagnaCare, United Airlines, the Northward Center, NJIT, PSE&G, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Hi, I am Dominique Lee. I was recognized in 2015 with the Russ Berry Award for making a difference, for helping revitalize our school system in Newark. The award had a significant impact in my life. Help us identify and honor the unsung heroes in your New Jersey community, who go unnoticed in their efforts to make a difference in the lives of others. You can nominate someone today for the Russ Berry Award for making a difference. The deadline for nominations is February 19, 2016.